I have the pleasure to introduce Dr. Stephen Sandage, our fearless leader of this wonderful conference. And thank you so much, Steve, for all that you've done to bring us together today. Dr. Stephen Sandage is the Albert and Jessie Danielson Professor of Psychology of Religion and Theology with appointments in the School of Theology and the Department of Psychological and Brain Sciences at Boston University. He's also the research director and senior staff psychologist at the Danielson Institute and visiting faculty in the Psychology of Religion and Psychology of Religion at the Norwegian School of Theology, Religion, and Society in Oslo. He is a prolific writer, and his recent books with the American Psychological Association include Forgiveness and Spirituality in Psychotherapy, Relational Spirituality in Psychotherapy, and Spiritual Diversity in Psychotherapy. He also practices as a licensed psychologist at the Danielson Institute with clinical specializations that include couple and family therapy, multicultural therapy, and spiritually integrative therapy. And the title of his presentation today is Seeking Well-Being in the Terrain of Despair, Relational Strengths for Practitioner Formation.
Thank you, Usha. Some of this research is funded by the Peel Foundation and by a grant from the Templeton Foundation. So quite a few of the presentations today have that. I want to start with a story and ask you to consider whether you've had what would be called a red pen moment when I go through this story. I know a chaplain. I'll call her Rose. This is a true story, but it's masked in a number of ways. She splits her time between a hospital chaplain position and being a faith leader in a small congregation. Fairly early in her career, but she's supervising a couple of students and racing between these two jobs in daycare for her young child. Rose cannot estimate the number of deaths she's seen in the hospital over the past 3 years, nor remember the number of funerals she's performed in her aging congregation. In addition to overexposure to traumatic loss, a typical week can include things like meeting with a young couple struggling in their marriage, fielding another request from a denominational official asking for her written plan on how to increase attendance at her congregation, meeting with the congregational board where the largest giver once again offers patronizing critiques of her ideas laced with possible racism, sexism, or both, and getting a note from another friend who's decided to leave ministry for a different vocation. But this brings us to red pens. In her hospital chaplain job, she chronically faces questions about her role. Some staff don't call her even when patients ask for a chaplain. The modest funds for professional development were recently cut by a hospital administrator who seems increasingly hostile and invalidating. This all cascaded to a situation where she had sent an email about the need for pens and other office supplies in their department, and she received an email response from that administrator saying no new office supplies would be ordered until they had used everything currently in the supply closet. Rose went to the closet, and all that was in there was a box of red pens. So the implication was that folks in that department were supposed to use red pens for everything. So Rose did what any rational person would do. Right? She took the box of red pens, she got in the elevator, she went down behind the hospital to the dumpster, and she threw the damn box of red pens in the trash. And then she reached out to a chaplain friend who would understand what she was struggling with. Because this really wasn't about red pens, right? This was about a systemic lack of care, an experience of a lack of regard, and the terrain of absurdity and despair. As was mentioned before today, that's not the kind of response Rose would ever give to a patient, right? The red pens were symbolic. They were a symbolic tipping point. And I think that invites us to reflect, have we had any of those kind of red pen moments in recent years or before? It's been a time of profound existential dysregulation, angst, and despair, as has been mentioned repeatedly today. And I do think at this time, going back to existential perspectives is as important as ever for many of us. As finite human beings, we struggle with existential themes even prior to our encounters with specific anxieties or specific trauma. And trauma is always existential. It always raises up profound predicaments about life, and as been mentioned today, it freezes us at points of meaning-making and growth. And we need a kind of relational security, another running theme from all the presentations today, that can reactivate flexible, healthy forms of meaning-making and help us to heal and grow. It's useful, I think, for us to come back to in communities of other professionals to think about the diverse existential predicaments we face. There's many good taxonomies of this. Some of us in the therapy world know Irving Yalom's work, which I've adapted a little bit here, around themes of death and loss, meaning versus absurdity, freedom, which is always in tension with guilt or responsibility, and isolation on the one hand, or engulfment into systems that we don't want to be sucked in by on the other. And of course, many of the influential existential perspectives were authored by white men, usually, who had an individualistic orientation. So we need to listen to folks like Fanon, who described the existential problem of colonization and the overdetermination of experience for some people, and to think about the way our systems crush existential meaning-making, particularly for those in marginalized communities. I think this sets the stage, again, themes we've been talking about all day, for the need to think about the relational formation of our therapists, clergy, chaplains, other leaders. There's a tremendous trauma risk, as has been mentioned. Dave Wang just described that. Libby Ruffing from our research team at Danielson led a study of trauma symptoms among religious leaders, which was very parallel to what Dave reported with seminary students. About a third of faith leaders reported trauma symptoms at the PTSD level related to ministry context trauma. The burnout risk, of course, is high for all professions. In collaboration with Shelley Rambo and Chaplaincy Innovation Lab and with some loose grant funding, we at Danielson were able to implement short-term support groups for chaplains over the past couple years. We just sort of dove into it. George Stavros, Miriam Bronstein, Laura Kaptari helped lead those efforts to put Zoom-based support groups into play with chaplains. And of course, we really had no idea how well those would work or what the impact would be. But I think it speaks to the profound isolation we've been talking about, that the groups did prove to be very helpful to many leaders who just needed a place to process some of the impact of what they were encountering, with people who would understand and who would get it. So we'll be expanding those groups in the coming years for therapists and for clergy with help from the Peel Foundation. Part of what I think can be helpful too is to consider a relational spirituality model as it pertains to this set of issues, with spirituality defined very broadly and inclusively as ways people relate to the sacred. Of course, some people don't self-define as spiritual, and yet other forms of meaning-making are important. And in this model, it really highlights the importance of ecological contexts, of relational dynamics surrounding people in their spirituality or their meaning-making, and the fact that a dialectic of dwelling and seeking often helps us understand the processes of what people are going through as they try to develop and as leaders try to develop with the existential challenges of ministry or therapy or whatever context they're in. This theme of dwelling speaks to what we've been describing as the need for close connections, places where we feel safe, places where we feel at home, places where we feel understood, that are regulating and that contributes tremendously to well-being. But this model also suggests that seeking is important, ways that we can explore, that we can consider new ways of looking at ourselves or the sacred or other people, ways that we can have a secure base to explore new terrain. And that generally maps onto a sense of growth that's necessary. So in our own professional development, those of us in the helping professions, it could be interesting to think about these subdimensions of dwelling taken broadly or explicitly in a spiritual sense, to ask where are there places that I find a sense of community, particularly with other professionals? What sorts of regulating practices help me to deal with the stress, the dysregulation of high levels of exposure to suffering? What helps me get a sense of presence, a theme that we've talked about in various ways today, or mindfulness? And what actually helps me come back to internalize commitments of what's important to me and what helps me feel meaning about the work that I do? We know that dwelling within secure attachments is a key to well-being among humans and other mammals, that this is a key to mental and spiritual health. And some of us may feel like the context of our practice are really strong in this area, but it's clear that others of us could find ourselves in places that are not securely attached professionally or personally, and where we're lacking in that kind of resource. The other key dimension of this model is spiritual seeking or existential seeking, and there's several dimensions to this as well. It involves exploring new understanding, openness to difference and diversity, tolerating ambiguity, and reflective growth in spiritual or existential complexity. And so dwelling and seeking in this model are somewhat in tension, as you can see. They're a part of human development, but there's a tension there. That when in dwelling I feel safe and secure and connected and grounded, in seeking I'm exploring new, unfamiliar territory, which can be exciting and stimulating, and sometimes it can be challenging, anxiety-provoking. And of course, spirituality and other meaning-making systems can help us make sense of this sort of tension that happens. While many of the aspects of dwelling I described are keys to well-being, seeking is clearly in the research oriented towards openness to difference, to diversity, to facing tragedy in the world, to being willing to take a look at systemic injustice. John Powell makes this point wonderfully, that if spirituality is to engage suffering and its causes, it must also be concerned with taking a look at institutions and structures and how they function in society. And as Dave was just touching upon, spirituality and religion can contribute to a commitment to social justice, to the kind of diversity work that we've been talking about all day, or spiritual and religious orientations can impede that. It cuts both ways empirically. And in this relational spirituality model, we've held up the need to invite folks, both at the individual and communal levels, to reflect on how that plays out. So dwelling and seeking, as I said, are a dialectic. There's different ways people can hold these. But there is some good evidence empirically from our research in clinical settings and religious leaders that in general, there's exceptions to this, but in general, over time it looks like there's advantages to a certain balancing of dwelling and seeking in terms of well-being and growth. That a sole focus on dwelling without any seeking sometimes leads to a kind of rigidity in meaning-making. Maybe even the authoritarian beliefs that Dave mentioned. A kind of chronic seeking without dwelling is a lot of stress, and it can become overwhelming to people at some point if they're not getting grounded and connected, at least to other people who understand the seeking and the searching. And a key to this sort of balancing, we'd like to suggest, are healthy and diverse relational ecologies that support both dwelling and seeking for people. Our research is also tuning us into humility, which has been a running theme throughout the day and most of the presentations in one way or another, which is a kind of interesting, unplanned convergence. Now, as we talked about earlier today, humility is sometimes misunderstood as a kind of extreme self-deprecation, self-abasement, negativity about the self. My colleague Claire Wolfteich led a project, interdisciplinary project drawing on theology and psychology that went back to the Latin root of humility as humus, or from the earth, from the ground, suggesting that a healthy kind of humility has this semantic association of being grounded. Not attacking the self, not failing to acknowledge one's strengths. It doesn't mean not speaking up about injustice or one's needs or wants. But it doesn't imply a kind of groundedness about one's own human limitations. And I often find it helpful to differentiate humility and shame, and even invite clients and leaders to reflect on what might be the differences between humility and shame. And in this sort of sense that Claire is getting at, that Karen and Jesse mentioned about cultural humility, humility is perhaps especially important for leaders because we so often bump into our imperfections, the limitations of our ability to help everyone, the human limitations that do require many of the things we've talked about, taking time off, getting diverse perspectives, submitting ourselves to empirical feedback from clinical practice. And these are all things that can cause tremendous shame and avoidance because of that. Humility is a relational strength that I think can help us deal with those issues without that kind of shame or self-diminishment. Our team has developed a model that considers 3 of the challenges to healthy humility among practitioners, and to try to invite leaders to reflect on these. Expansive grandiosity, reactivity to difference and conflict, and hiding the self. We used this model in a study that Peter Jankowski wrote up in a sample of seminary students and have presented it in different contexts. In that particular study that Peter wrote up, we invited a large group of seminary students to reflect on these issues in a formation context, to even do some journaling and noting about what they in particular might struggle with in these areas. I'll describe in a minute. And then to consider practices that might help them deal with that particular challenge. Now, expansive grandiosity is one that is maybe easily contrasted with humility. That's what might become most obvious. It could manifest in overfunctioning, in perfectionism, in narcissism, in ways that any of us could have trouble accepting our human limitations and to continue to try to rise above our humanness, to accomplish something, to be perfect. The particularly pernicious side is a kind of superiority over others that can result in tremendous harm. Reactivity to conflict and difference is a regular challenge within any kind of helping profession or leadership experience, right? It can manifest as ethnocentrism, shame, resentment, difficulty metabolizing the kind of conflicts and differences. I think back to Karen, your presentation about calling in and a way of trying to deal with ruptures in a constructive way. Hiding the self might be an underrated challenge to humility, because there could be some people who really don't bring themselves forward who could, in a sloppy definition of humility, seem quite humble. But hiding the self, which can manifest in a variety of ways, it could manifest in isolation, it could manifest in hyperautonomy, it could manifest in addictive tendencies towards coping. It's not really about introversion or extroversion. It's about whether someone can find ways to connect authentically with others and to present whatever needs are necessary to get help with. And in our empirical research, each of these 3 temptations, if you will, are negatively associated with humility. And we think it could be helpful for any of us in these fields to have regular opportunities to reflect on these, to do some self-assessment, to talk to people we trust, get a sense of where we may need to focus some work. We also have been throughout the day highlighting contextual factors that can limit well-being among helping professionals. Not just individual, but contextual factors. And in terms of the relational spirituality model I'm holding up, can limit healthy dwelling and seeking. So let's think about it through that angle. These are a list of factors that are identified in the research literature. Our team is still in the throes of sorting our way through this complex literature on well-being of therapists, clergy, and chaplains, but there's a few factors that we can ferret out as valuable, and I think that we can come at this set of issues from a couple different angles. If we're someone who is a helping professional and we're not really guiding or directing a context, but we're sort of just subject to it, to think about which of these characterize the environments that we're working in, at least for the point of awareness. But I'm sure, some of us in this room and some of us watching do have leadership influence over practice contexts, over the systems that people work in. And it would be good for us to take note of these as well, I think. So work and role overload. Work overload's an obvious one. Role overload is when people have too many different roles that they're juggling, and at some points that's part of the strain, that there's just too many different things. I go back to Rose, who was having to cobble together a couple of positions because of low rates of remuneration and really working kind of 2 full-time jobs but only getting paid part-time for each, right? There's a strain to that, a strain that a lot of people will have a hard time understanding if they haven't done it. Perfectionistic and or competitive ethos. What's the system ethos that we're in our helping roles? How much perfectionism is it? How much competitiveness is there? I'm not sure that that's always identified as much of a stressor as it can be in some settings. Inequity, injustice, recognizing different pay scales, different opportunities. Relational aggression. In some of the studies with religious leaders and the trauma research, both in our lab and other places, one of the underrated factors is really aggressive people in congregations who attack leaders, sometimes, unfortunately, in very mean ways, abusive ways. Dave mentioned that. That can happen in any system. That can happen in mental health systems. And there's a need for leadership to think about the way that plays out in context. Limited professional growth and training opportunities. If we go back to the need for dwelling and seeking, human beings have a need for dwelling and for seeking in some particular balance that doesn't apply the same to everybody. But it's interesting to note that in some contexts, they're very rich in opportunities for growth, learning, continuing education. There's resources for that. In other contexts, there just isn't, like the context of Rose's that I mentioned. One of the reasons we felt so good about this Peel funding for this kind of project is to be able to make some continuing education opportunities, at least at the basic registration level, more accessible. But that can really be discouraging for people who want to grow in their skill and their abilities, and there just really aren't opportunities for that. One of the places I worked early in my training was a clinical environment. Of course, many of us who are trained clinically worked through quite a few of them. And I can remember as an early trainee being so eager to learn things and being so struck that the groups they set up, they were kind of consultation, supervision groups. We had to be at them every week. And they were marked, and I was in about 3 of them over the course of a year. And each one of them was so characterized by a sense of fatigue and burnout among the more senior clinicians. I don't necessarily blame them. That was the difficult context. But we were actually spending time in groups with really no learning happening, and mostly a kind of, patients are difficult kind of stuff. it's really tough when I think early career people especially are in environments that don't provide healthy growth opportunities and opportunities for learning. Opportunities for research and consultation can be really stimulating, and when that's not an option, that can be difficult as well. Lack of openness to input for systemic change, lack of diversity, competence, and inclusion, avoidance of processing vocational stress and suffering. Have you seen systems that make spaces for that among people, whether they're doing clergy work, chaplain work, therapy work, other spaces where people can connect and process just the stress of working with folks who are suffering? Again, it invites us to reflect on the need for dwelling and connection, the need for seeking of new understanding and growth, and the impact of that potentially on burnout and well-being, and inviting us to think about what could be offered that way. Let me close by describing what we're thinking about in terms of possible pathways in a positive direction towards this theme that came out of some of our early conversations around this conference. George Stavros, Ushita Molinara, Laura Kia and I were talking about this conference and thinking about how to frame it initially. And this idea of transforming our community of healers emerged. What would it mean to try to think not just about individual steps towards well-being and avoiding burnout, but thinking about the kinds of communities that we need among helping professions to be more life-giving, to be more enriching? So let's just name a few of those themes that I think emerge out of this perspective with kind of the sense of invitation that these are things that we think we need to spend a lot of more time in discussion about and consider together. First, as has been named today, facilitating interdisciplinary collaboration and learning. This might not seem obvious to some, but it's actually been named today, that there's something that can come out of talking across our disciplines, whether it's chaplains talking to therapists, or theologians talking to psychologists, or various kinds of therapists. On those of you listening today, we saw a tremendous list of vocations and fields. And there's something stimulating that can come out of that sort of healthy, respectful dialogue and learning. Now, this isn't simple to pull off. I end up in a lot of interdisciplinary spaces in my work, and I'd say about half of them seem helpful. About half of them fall into sort of disrespectful one-upping each other or turfism. So that circles us back to the relational dynamics. Just because you put a couple people of different disciplines in the room doesn't mean that it's enriching or formative, right? It requires some of these other relational strengths. Maybe those could be cultivated if we come in at the right attitude, but we can't just be sloppy about that. There's a great opportunity here, but I think on average it looks like among our communities of professionals we could do better. As has been raised today, I think it would be constructive to think about both preventing burnout and promoting well-being. Simply preventing burnout for a lot of reasons mentioned today, multiple presenters highlighting the complex relationship, simply trying to prevent burnout is not a sufficient goal. The higher bar would be to consider how to facilitate well-being among helping professionals. What will really help people grow and move towards flourishing? How can cultural humility, cultural competence, and social justice in organizations and professional ecologies be encouraged? That's again been a theme of the day. It comes back to the idea that our communities of healers will need these capacities, not just at the individual level, but in organizations. Those of us who hold tremendous privilege, as I do, need to show leadership in this area of working towards that. We need multi-textured professional growth strategies. Sure, self-care, specific practices, but various kinds of professional and personal growth. And again, I would hold out, in our model at least, thinking about the balancing of dwelling and seeking. So how can professional growth include things like this, a large group discussion that hundreds of people are watching online, but how can we also create intimate spaces of knowing and being known, deep conversation, as has been mentioned, exposure of our own work with constructive feedback. And finally, maybe no surprise that those of us all on the panel are scholars as well as practitioners. I do think that we need more research on practitioner formation and well-being over time in particular. As my team is, I said, sorting through the research, it's clear that there's a decent body of research. We need more of it that tracks the impact over time on clergy, on therapists, on chaplains, in various aspects of formation and well-being. And maybe at some point, as we get clearer about those issues and those dynamics, we could also invite organizations, clinics, religious bodies, chaplaincy groups to tune into a certain kind of accountability where our systems do try to hold themselves accountable to what's the impact on the people that are working in our systems over time. All people, what's the impact over time? So going back to the red pens, I think it does behoove us to find places where we can tune into our own responses to the territories of despair. There is no working with people who are suffering. We could even say there's no real living in our world without venturing into the territory of despair. That's part of life. Many of us who are committed to spiritual and religious traditions would also note that's part of spirituality and religion. It's part of humanness. Despair is a reality that we will have to deal with. The question is, where do I have points of connection with people who can handle that, who can meet in that terrain and help metabolize that and find ways to grow in the midst of it? Thank you.